Chloe, and today I'm going to persuade y'all to vaccinate your children. Are vaccinations safe? A lot of people think that they're not. Some think that they cause autism, some think that they cause cancer, but they say that it's more effective to get the shot and it's less likely for you to get the sicknesses than if you don't get the shot. So that makes them safer. Getting vaccinated outweighs the very small risk of serious problems. Vaccines have made many serious childhood diseases rare today. These are all the vaccines you get as a child if your parents choose to get them. The flu vaccine is just the one most grown-ups get it today too. That just prevents the flu. The DTaP vaccine it's 3 shots in one, and it is for diphtheria, tetanus, and pertussis, which is it attacks your throat and it attacks the heart, and it can cause heart failure, which can cause you to die. You get these when you're 2 months old, when you're 4 to 6, and then you get the TD vaccine, which is the booster for the DTaP vaccine. The TD vaccine is the booster for the DTaP, and the rotavirus vaccine it protects against rotavirus, and that causes diarrhea in most babies and young children. Just like that one, you get it at 2, 4, and 6 months of age, and you should not get them no later than 8 months. The IPV vaccine is polio, and polio isn't really a thing that you see nowadays. This was more common back in the old days, but it's muscle pains, and it can cause paralysis, and can cause your legs and your arms to just be paralyzed. It paralyzes them. Okay. The MMR vaccine it prevents the measles, the mumps, and it's given 2 shots when your child is 1, and then when you're 4 to 6 years old, and that is rash, fever, cough, runny nose, and watering eyes. It can also cause really bad ear infections and pneumonia. And if you were to be pregnant and catch this, it can also cause you to lose your child, or your child can be born blind or deaf. And this is actually the shot that they say causes autism, but research has shown that there is no link between the two. The HIV vaccine is also another one, and that helps prevent the influenza type B, and it is a leading cause of illness in children, and it can cause meningitis, pneumonia, and a severe throat infection. You get this in 3 or 4 shots from 2 to 15 months. The varicella vaccine is the one to prevent chickenpox, and this one is really controversial because sometimes you can get this shot and you can get the chickenpox. The HPV vaccine, it helps prevent hepatitis B, and that is the liver and the throat. It's the liver and throat, and it can cause cancer, and you can die. And you're supposed to get that shot as soon as you give birth. They're supposed to get it. The pneumococcal conjugate vaccine and the meningococcal conjugate vaccine, they're pretty much the same thing. The only difference is that the pneumococcal, it has a really bad case of giving children ear infections, and then the meningococcal conjugate vaccine, it causes bacterial meningitis, and it is infection of the fluid around the brain and the spinal cord. You get the pneumococcal conjugate vaccine when you are 2, 4, 6, and 12 months of age. And you get the meningococcal when you are 11 and 12 years of age. And the last one is HPV vaccine. Next. Important reasons to get the vaccine is it can save your child's life. Another one is your child cannot get into a school without having these shots. So a lot of kids who don't get their shots, they have to be homeschooled because they won't let them go to a public school or even private schools. It can save a family time and money because if you stay sick all the time, that's just your parents having to spend money at a doctor's office. Immunizations can protect future generations, and it is effective, although a lot of people say that it's not. Right, these are some pictures. The top one is the diphtheria, and it attacks the throat and the heart. The second one is polio, and it's the muscle pains and paralysis. And you can tell that's an old picture because that happened more in the old days. This is pneumococcal vaccine, and it is the ear infections, meningitis, and bacterium. This is the varicella, which is just the chicken pox. And then MMR, and that protects against mumps and the measles. Thank you all for listening to me give my speech today.